Reopening. Dr. Fauci warning 24 hours ago, if we're not careful, we could cause outbreaks. Tonight, the president saying, to me, it is not an acceptable answer, especially when it comes to schools, adding that Fauci wants to play all sides of the equation. This all comes tonight as the CDC now prepares to issue a national alert to doctors about that dangerous condition affecting children. Many doctors believe it is linked to coronavirus. Tonight, at least 16 states now investigating cases. What parents need to know if they start seeing symptoms. And tonight, the doctor treating a 14-year-old girl, recognizing the signs and immediately having her rushed to the hospital. Tonight, nearly the entire country, including parts of New York State, now easing restrictions by this weekend. And reports tonight, an internal administration document reportedly showing cases spiking in Nashville, Des Moines, and parts of Kentucky. In Florida, 3 of their deadliest one-day tolls this week alone. Los Angeles expected to keep some form of stay-at-home orders in effect right into August now. And tonight, colleges and universities. Cal State already moving classes at all state universities online for the fall. But this evening, one university preparing to fully reopen. And ABC News getting a first look inside their own lab. They say they will take testing into their own hands to protect their students. Could this be a blueprint for others? Your money tonight, American families facing rising prices at the grocery store. Prices spiking for beef, chicken, and eggs, among other products. The biggest one-month increase in nearly 50 years. We'll go down the list, and tonight the out-of-work mother of 5 saying her family is now having to skip meals, saying her grocery bill has gone up $50 a week. The questions tonight over air travel, passengers' concerns growing, a patchwork of policies from the airlines. Is it enough to keep Americans safe? And tonight, actor Matt Damon and what he revealed about one of his own children and where Damon and his family is tonight. There's also news coming in on that Broadway actor battling COVID who had his leg amputated. He'd been in a coma. The new headline on Nick Cordero from his wife tonight.
This is ABC World News Tonight with David Muir.
Good evening, and it's great to have you with us here on a Wednesday night. And it's the anxiety being felt across this nation, really the dilemma of being faced by so many. The millions of Americans who do want to get back to some sort of normal, get back to work, but who are also worried about their health. And tonight, just 24 hours after Dr. Fauci was asked by senators about reopening the country, Dr. Fauci saying if we're not very careful, there is a real risk you will trigger an outbreak you may not be able to control. Tonight, President Trump now saying, I was surprised by his answer. He said, to me, it's not an acceptable answer, especially when it comes to schools. President Trump saying Dr. Fauci wants to play all sides of the equation. But of course, all of these are important questions to ask. Will our school children be safe in the fall? Will American workers be safe in the coming weeks as we now prepare to ease restrictions in at least 48 states? And all of this with the death toll rising, more than 83,000 lives lost in this country. Tonight, the internal government document reportedly showing spikes in several parts of the country, Tennessee, Iowa, Kentucky, among other places. Across the country, states now imposing a patchwork of rules to try to control any new spread. Los Angeles County, for one, now saying some stay-at-home orders may stay in place until August. New questions about protecting American workers and children, of course, that dangerous condition many doctors believe is linked to the virus. New York now investigating more than 100 cases. 3 children have died. Cases now in at least 16 states tonight. The president was also asked about this as well this week, about children, whether they're safe as we now reopen the country. And we'll guide you through it all. A very busy Wednesday night. And we're going to begin here with our chief White House correspondent, Jonathan Karl.
Another sign of the times. Vice President Pence arrived at the White House today wearing a mask. He's been keeping his distance from the president since his press secretary tested positive.
I haven't seen Mike Pence, and I miss him. I guess we said for a little while we'll stay apart because you don't know what happens with this very crazy and horrible disease.
This was the president's first public appearance since the stark warning from Anthony Fauci about states reopening without meeting federal guidelines.
There is a real risk that you will trigger an outbreak that you may not be able to control.
The president bristled a bit when asked about that.
Look, he wants to play all sides of the equation. Some governors and some perhaps partisans, maybe for election reasons, don't want to have their states open. And then some shouldn't open them quite yet. You know, they're not ready. They went through a lot and they're not quite ready. But no, we're opening our country. People want it open.
The president was asked what he meant by saying Dr. Fauci plays all sides.
When you say Dr. Fauci is playing both sides, are you suggesting that the advice
Well,
he's giving to you is
I was
different?
surprised by his answer, actually, because, it's just, to me, it's not an acceptable answer, especially when it comes to schools.
So let's get right to John Carl with us live in Washington. And John, I know all of this comes as the president wants to signal himself that America should reopen now, traveling to Arizona last week where we sat down with him, of course. And tomorrow he's back out again, this time in Pennsylvania. And not surprising to you and me, John, that these are key battleground states for the election. But taking on Dr. Fauci could also be tricky because Dr. Fauci, at least in the polling, shows he's trusted by the majority of the American people on this.
Well, David, there's certainly a public health risk in disregarding the advice of the nation's or the government's leading expert on infectious diseases, but there may also be a political risk as well. Dr. Fauci has emerged as the most trusted figure in America on questions related to this pandemic. And in one poll out just this week, nearly twice as many Americans said they trust Dr. Fauci when it comes to coronavirus than say they trust President Trump. David?
John Carl leading us off tonight. John, thank you. And you heard the president say there, Dr. Anthony Fauci's answer about being extremely cautious because of the risk of outbreaks you might not be able to control. The president saying that answer not acceptable. And you heard him say, especially when it comes to schools. Parents are rightly concerned in the country, and they're also concerned about that condition we've been reporting on, possibly linked to the virus. Doctors believe so. Cases now under investigation in 16 states. And tonight we've learned the CDC is actually preparing to issue a national alert to doctors because recognizing the symptoms can make all the difference. Here's Stephanie Ramos on this again tonight.
Tonight, the CDC is preparing a national alert for doctors to be on the lookout for that inflammatory syndrome in children, possibly linked to COVID-19. Concern now growing. 16 states are reporting cases. Just days ago, 14-year-old Leah was rushed to the Randall Children's Hospital in Portland, Oregon.
It was super weird pain that I was having. Like, it wasn't normal. It was like my stomach was hurting. I was like really hot.
The healthy soccer player coming down with fever, abdominal pain, and red eyes. All symptoms her pediatrician spotted as signs of that rare mystery illness, possibly linked to COVID-19.
Her primary care doctor actually had heard and knew of this syndrome and called the paramedics and sent her over to the emergency department really quickly.
Leah was close to cardiac failure, almost in shock, but was treated for severe inflammation doctors suspect was triggered by an earlier infection with coronavirus.
I'm very grateful because I could have been gone. I'm glad I got help right away.
All of this amid heated debate over how and when to reopen schools. The president asked about reopening schools in light of this new syndrome.
This newly emerging syndrome now among young children. What do you say to parents who would like to get their children back to school but are now looking at this and potentially afraid to do that?
Well, again, it's a tiny percentage, but you're right. So we're looking into it very strongly. And the Admiral, as he said, he's known about this for long before this happened. But it is a very, very small percentage. And people recover from that. The children recover from that. Right?
Yeah, yes, sir. Most do recover from this, but it is a serious and it can be a fatal condition.
Tonight, the CDC is preparing a national alert for doctors to be on the lookout for the syndrome so it can track the illness. 16 states are now reporting cases.
A lot of these kids are coming in shock and are needing pretty aggressive intensive care support.
In New York City, cases jumping from 52 to 82 overnight. For 14-year-old Jack McMorrow, it started with a fever, stomach illness, and a rash. His doctor suspecting that inflammatory syndrome.
I had a swollen lymph node on my right side, and I got a headache, and it just started going downhill from there.
Rushed to the hospital, Jack's heart and organs were failing. After testing negative for the virus, his mother insisting they check again. That second test confirming Jack was fighting COVID-19.
What message do you have for parents right now?
They're their children's best advocate, and they need, if they suspect something wrong, pursue it. If it wasn't for his mother pursuing it as hard as she did, I don't think my son would be here.
Stephanie, back with us on this again tonight, and that boy thankfully now recovering. We all love seeing those images, and I know that New York and several other states now trying to raise awareness about this illness, and this new CDC alert would go out to all doctors. What more have you learned tonight?
Well, David, the CDC says they will warn thousands of doctors across the country, asking them to report cases of the syndrome to state and local health departments. This way, the CDC can learn more about the illness and also get a better handle on those cases. David.
All right, Stephanie, our thanks to you as well. And of course, that patchwork of state rules for businesses and schools affecting colleges and universities as well. California's public college system saying they'll be online in the fall, while the University of Arizona, for example, tonight has a different plan to take on testing for their students on their own. So how will this work? Tonight here, Tom Llamas getting a first look as we also learn of a government document reportedly showing spikes in cases in several parts of the country.
Tonight, 24 hours after America's top doctors warned about the dangers of reopening too quickly, evidence the coronavirus is spreading in the heartland. An internal administration document reportedly shows new cases spiking in Nashville and Des Moines. Central City, Kentucky reporting a massive increase as of May 7th. And now, Los Angeles County officials indicating stay-at-home orders may stay in place until August.
We'll never be completely open until we have a cure.
Protesters rallying in Michigan today in support of 77-year-old barber Carl Mankey, who's kept his shop open in defiance of state orders. Michigan Governor Gretchen Whitmer saying these protests risk a resurgence of the virus in her state.
They are not wearing masks. They are not staying 6 feet apart. And then they go back home into communities, and the risk of perpetuating the spread of COVID-19 is real.
And tonight, new reporting on those CDC documents that were supposed to provide guidance to communities and businesses on steps to reopen. The White House reportedly holding them back, saying they're too restrictive. CDC Director Robert Redfield asked when that guidance would be released.
But we're reopening in Connecticut in 5 days, in 10 days. When are we going to get this expertise from the federal government?
I do anticipate this broader guidance, though, to be posted on the CDC website soon.
Soon isn't terribly helpful. Thank you, Mr. Chairman.
Fearing a second wave, Harvard Medical School saying it will provide remote learning for students entering this fall. Just a day after Cal State University, the nation's largest 4-year public university system, canceled all in-person classes for the fall. But at the University of Arizona, in-class learning will start on schedule this fall. The school taking testing into its own hands to protect its students. ABC News getting an exclusive look at how they plan to do it. At the heart of the project, the research labs, where they've created and now process their own diagnostic and antibody tests.
If there's an outbreak on campus, you're going to learn about that right here. We will.
The school's president, a cardiothoracic surgeon, telling me he's confident they can test, track, and help treat their 60,000 plus faculty, staff, and students, even reserving a dorm building to be an infirmary if needed.
You know, this could be the blueprint on how to reopen, or it could be a blueprint for a disaster.
Absolutely right.
Have you thought about that?
Oh, absolutely. Every day. Every day. We've got 104 days before we're scheduled to welcome people back to campus. It'll look very, very different.
And still, with so many unknowns, some images of hope. Isaiah Wallman, the last COVID patient to leave this Tennessee hospital after fighting the virus for more than 50 days. And David, back here on the campus of the University of Arizona, the president here says he has a plan. As you just heard, he has about 100 days to figure out the details. He says students will be wearing masks. They will social distance, but they have the hard part down, the testing. But he does acknowledge, David, the really tough part, what happens off campus. David?
Yeah, really interesting, Tom. Bold plan, but as you pointed out, risky, and you'll keep us posted on this, Tom. Thank you. We're going to turn to your money tonight and the rising prices at grocery stores across this country, the challenged supply chain, and grocery store prices jumping now, the biggest one-month rise in nearly 50 years. And tonight we hear from the families now skipping meals. Here's Victor Akendo on this again tonight.
Tonight, those new numbers showing record-breaking prices at grocery stores are forcing families to make tough choices.
If something's gone up $1, I'll either find an alternative or honestly not purchase it.
Kelly Johnson from Dunedin, Florida, says her grocery bill has gone up $50 a week.
These shelves used to be full, overflowing. It's looking pretty bleak. Milk's going out.
The single mother with 5 kids at home doing what she can until she can go back to her job as a restaurant manager.
We sometimes have to skip meals. We're down to 2 meals a day. It feels like I'm failing as a mom to take it to that extreme.
It's the biggest jump in food at home prices in nearly half a century. Eggs up more than 16%, hamburger meat up nearly 5%, chicken up nearly 6%, some pork products up more than 10%. Before the pandemic, Americans were spending more than half their food budget on eating out.
People are staying home, they're not going out anymore. And so there's a big increase in regards to sales in grocery stores. Grocery stores are seeing on average over 25% sales increases.
The other byproduct of increased demand that's hurting families are less deals.
A lot of these grocery stores are not offering things on sale. You're really going to have to do your due diligence as a shopper because you're not going to see many promotions in these stores anymore.
These prices might continue climbing. Experts predict they could go up 4% by the end of the year. David?
All right, Victor, thank you. And with Americans beginning to travel again, the images and, of course, the questions tonight for the airlines, who all seem to have different policies, no central set of rules, and some passengers are rightly concerned. ABC's Gio Benitez covers aviation.
Passengers all over the country are sharing photos of flights they believe are too crowded during a pandemic. The number of domestic flights down nearly 70%, but more people are beginning to fly. Now tonight, calls for federal action on social distancing. Airlines have imposed their own policies, but they're not all the same. American Airlines says it is blocking half of all middle seats. United says it is trying to keep a seat open beside every passenger, but doesn't guarantee it. And Delta says it is only booking half of first class and 60% of the main cabin. Senator Richard Blumenthal says the government should step in.
Do you think this is something that Congress would take up?
If the Department of Transportation fails to do its job, Congress should do it for them.
And David, tonight every major airline tells us if you don't feel comfortable, they will change your flight, even if you've already boarded the plane. David?
All right, Gio, thank you. When we come back, severe storms tonight and tomorrow, and actor Matt Damon with news on his oldest daughter tonight.
At Fisher Investments, we do things differently, and other money managers don't understand why.
Because our way works great for us.
But not for your clients. That's why we're a fiduciary, obligated to put clients first.
So what do you provide? Cookie cutter portfolios?
Nope. We tailor portfolios to our clients' needs.
But you do sell investments that earn you high commissions, right?
We don't have those. So what's in it for you? Our fees are structured so we do better when you do better. At Fisher Investments, we're clearly different.
Here's the thing about managing multiple clouds for your business. When you've got public clouds and private clouds and hybrid clouds, things can get a bit cloudy for you. But now, there's the Dell Technologies Cloud. Powered by